Welcome to OB-GYN Clinical Clerkship. Hashtag OB-GYN Vlogs. This video is prepared by Senior Clerk Odyssey Key. For today's topic, we're going to talk about CTG or cardiotachography. It's used during pregnancy to monitor fetal heart rate and uterine contractions. It is most commonly used in the third trimester, and its purpose is to monitor fetal well-being and allow early detection and fetal distress. For interpreting CTG, we usually use the abbreviation Dr. C. BRAVADO. In defining the risk, we assess if the pregnancy is high risk or low risk. High-risk pregnancies are as follows. Contractions is counted as a number of contractions in a 10-minute window period. For this CTG tracing, we can identify 7 contractions in 10 minutes, with the sum of all contractions as 700 MVU. Baseline rate is the average heart rate of fetus within 10-minute window period. So the normal baseline would be 110 to 160 BPM. For the same CTG tracing, we can identify the baseline rate of 190 BPM, which means that fetus is tachycardic. The variability is the variation of fetal heart rate from one beat to the next, and this is considered the most consistent indicator of fetal well-being. Variability is classified as absent, minimal, moderate, and lastly, marked. For this CTG, moderate variability, since most have at least a 5 BPM deviation from the baseline. Variability is noted as the beat-to-beat oscillations of your FHT. For the accelerations, it's the apparent abrupt increase of at least 15 BPM in FHR above baseline. So for this CTG tracing, there's no acceleration identified. For decelerations, it's the decrease in baseline heart rate of greater than 15 BPM for more than 15 seconds. So it is classified as early decels, late decels, variable decels, and prolonged decels. For the same CTG tracing, we can classify a variable decels to as low as 165 BPM with a pickup of baseline in 30 seconds. For the overall impression of the same CTG, first, we need to know the CTG classification system, which was revised in 2015. The overall impression would be Category 2, suspicious. Now let's interpret another CTG tracing. Using the same methods, with Dr. C. BRAVADO, we define the risk of the pregnancy, and we can count contractions of 4 in 10 minutes, with a total of 330 MVU. The baseline heart rate would be 165 BPM, which means that the fetus is also tachycardic, with a minimal variability and no accelerations were identified. In this CTG tracing, we can identify recurrent late decels to as low as 60 BPM. With this CTG tracing, the overall impression would be Category 2, pathologic. We can see here that the deceleration is late because it starts at the peak of the uterine contraction, and it's also repetitive because the decels are associated with greater than 15% of the contractions. Thus, this is a recurrent late decels to as low as 60 BPM. Thank you so much for listening. This is the end of the recording.